If you're over 40, training hard, eating clean, sleeping well, and still not recovering like you used to, growth hormone peptides might help, but only if you understand how they really work. If you're new to my channel, welcome. My name is Dr. Steve Jones. I'm a medical doctor specializing in longevity medicine here in Texas. I help driven adults add life to their years. Today we're talking about one of the most misunderstood and often overhyped areas in performance and longevity, growth hormone peptides. Specifically today, we're going to break down Sermorelin, Tesamorelin, Ipamorelin, and CJC 1295. We'll cover what they're actually good for, which ones are FDA approved and for what, and why none of them will work the way you hope if you skip the fundamentals. And as always, remember, this is for educational purposes only. Peptides are prescription-only compounds in the United States, and some are often used off-label in longevity medicine. These are not supplements. They're not magic. They require medical oversight. But first of all, let's back up and look at the big picture. Growth hormone peptides are compounds designed to stimulate your body to produce and release its own growth hormone. So that's an important distinction. We're not talking about injecting synthetic growth hormone. We're talking about signaling your pituitary to increase normal physiologic pulsatile growth hormone release. When growth hormone is released, it increases IGF-1 in the liver and then other tissues as well. IGF-1 then mediates many of the downstream effects that we're looking for. Improved body composition, increased lean muscle mass, a reduction in visceral fat, better recovery, improved sleep quality, and even some possible skin and connective tissue benefits. But here's the truth. If your sleep is broken, if your nutrition sucks, if your testosterone or estrogen are low, if you're inflamed and metabolically dysfunctional, peptides will not fix that. See, in my clinic at Revive Longevity Center, peptides come after foundations are already in place, not before. Now, it seems like there's a lot of confusion online about what is FDA approved and what isn't. So very clearly, FDA approved, number one, Sermorelin. Previously, this was FDA approved for pediatric growth hormone deficiency. It is not currently marketed commercially, but it does have a history of FDA approval for that indication. And number two, Tesamorelin. It is FDA approved for HIV-associated lipodystrophy, specifically reduction of excess abdominal fat in HIV patients. And that's it. Not FDA approved are things like Ipamorelin and CJC 1295. Now, these are commonly used in longevity and performance medicine. But remember that they're not FDA approved for that, for anti-aging, for muscle building, or for body composition. That doesn't automatically make them unsafe. It means that they're used off-label, and that requires careful medical judgment. I'd like to start really just by talking about Sermorelin. It's a growth hormone releasing hormone, a GHRH. It's an analog. It stimulates the pituitary to release more of your natural growth hormone and to do so in a normal physiologic pulse. Now, historically, it was approved by the FDA for children with growth hormone deficiency. In adults, we often use it off-label. Some of the benefits that we see from it include a mild to moderate increase in IGF-1, improved sleep quality, better recovery, subtle body composition shifts that can improve over time. Now, Sermorelin tends to be gentler. It respects the body's biofeedback mechanisms. If your IGF-1 rises too high, your body self-regulates. And so that makes it attractive from a safety standpoint. However, results are usually modest. So if someone comes in expecting dramatic fat loss in 6 weeks, they're probably going to be disappointed. In my experience, Sermorelin works best in patients that are over 40, patients with low to normal IGF-1 levels, and patients who have already tried hormones and they have them optimized. And then, of course, it's going to work best in patients that are committed to sleep, resistance training, and good protein intake. The second peptide I want to talk about is Tesamorelin. Now, this is also a GHRH, or a growth hormone releasing hormone analog, but it's more potent than Sermorelin was. It is FDA approved specifically for reducing excess visceral abdominal fat in patients that have HIV-associated lipodystrophy. That's its official indication. What makes Tesamorelin interesting is the measurable effect on visceral fat. In studies, it has shown significant reduction in abdominal fat in that specific patient population. Now, in longevity medicine, we often use it off-label for central adiposity, for metabolic dysfunction, and to try to help to mobilize stubborn visceral fat. Its potential benefits are that it gives a stronger IGF-1 increase than Sermorelin does. It also helps with that visceral fat reduction. It improves metabolic markers. And like all growth hormone stimulators, it works better when things like insulin are controlled, when sleep is optimized, when resistance training is consistent. If cortisol is chronically elevated and insulin levels are high, growth hormone signaling is going to be blunted. Okay, the third peptide to talk about today is Ipamorelin. So Ipamorelin is a growth hormone secretagogue. Specifically, it mimics ghrelin and it stimulates the ghrelin receptor, triggering then growth hormone release. Now, unlike older secretagogues, Ipamorelin is more selective. It tends to stimulate growth hormone without significantly increasing cortisol or prolactin, and that's one reason that it's so popular in performance medicine. So some of the benefits that we'll see is that it increases growth hormone pulses. It improves recovery. You get these sleep benefits from it. We also find that it helps to support lean muscle mass. Ipamorelin is often stacked with other growth hormone releasing hormones like CJC1295. And why is that? It's because the amplitude of the signal and the other increases the pulse frequency. So Ipamorelin is going to increase the pulse frequency where other secretagogues like CJC are going to help with the overall waveform of the growth hormone release. So together they create this synergistic effect. But again, remember that this is off-label medicine. It requires thoughtful dosing and ongoing monitoring of IGF-1. Okay, the last one to talk about is one that I just mentioned, CJC1295. It's another growth hormone releasing hormone analog. Now, there are two forms that are commonly discussed, CJC with and without another chemical called DAC. DAC makes CJC1295 last longer. The other form is shorter acting. Now, the long-acting version can elevate growth hormone levels for a prolonged period. The shorter acting version mimics a more natural pulsatile release. So in longevity medicine, most clinicians like myself prefer physiologic pulses rather than chronically elevated growth hormone. And why is that? Because chronic elevation of growth hormone is not the same as youthful pulsatility. Our goal, remember, is optimization, not excess. Now, the potential benefits that we see from this particular peptide are increased IGF-1 levels, improved body composition, and an enhanced recovery. But here's an important point. If IGF-1 goes too high, that's not necessarily better. Longevity medicine, remember, we spoke about this a minute ago, is not about maxing everything out. It's really more about balancing. So some safety considerations that you should think about if you're looking at growth hormone stimulation. It can cause fluid retention. If that happens in your wrist, that can lead to carpal tunnel syndrome. Anywhere else, it could lead to joint stiffness. And then insulin resistance if the growth hormone release is excessive. That's why lab monitoring does matter. In my practice with my patients that are on these regularly and are on my longevity protocols, we regularly monitor your IGF-1 level, fasting insulin levels, A1C, lipids, and a host of inflammatory markers. It doesn't really work to, quote, set it and forget it, right? Peptides should not be used in patients with active cancers and in certain high-risk conditions without really talking to your doctor and having some good oversight into that. So another thing to talk about is quality matters a lot. This may be one of the most important parts of today's discussion. Peptides are not supplements. There is enormous variability in compounding quality, sterility, dosing accuracy, and sourcing. So when you see really cheap peptides online, you should stop and ask, Where were they manufactured? Was sterility testing even performed? Was purity verified? Is there a certificate of some type of an analysis of it? Poor quality peptides means that you may be getting underdosed. Even worse, you may find contamination with endotoxin and bacteria, and you may find that there's just no clinical effect at all. In longevity medicine, quality is really not optional. So if you're going to manipulate growth hormone pathways, you need pharmaceutical grade sourcing through reputable compounding pharmacies. All right, the foundations come first. Let me be really direct here. I've alluded to it a few times already, but if someone comes into my clinic and says, hey, Dr. Jones, I want to do some growth hormone peptides. My first question is not, well, which peptide do you want? My first question is, how was your sleep? What was your fasting insulin? What's your testosterone level? How much protein are you eating? Are you doing resistance training regularly? Because growth hormone is amplified during sleep. If you're sleeping 5 hours a night and waking up at 2 o'clock in the morning, no peptide is going to compensate for that. If your testosterone is low, muscle building signals are blunted. If your estrogen is out of balance, recovery is going to suffer. If you're not training with progressive overload, you're not giving your body a reason to partition nutrients toward muscle, and you're not going to get the gains that you're looking for. Remember, peptides amplify signals that already exist. They don't create discipline. In my model, we follow a sequence. We want to optimize sleep, balance hormones, control insulin and inflammation, dial in protein and resistance training, and then it seems appropriate to consider advanced tools like peptides. When foundations are solids, peptides can really enhance. When foundations are weak, peptides are going to disappoint. Okay, so who's a good candidate? In my clinical experience, ideal candidates are adults over 40, patients with declining IGF-1 levels, individuals with optimized sex hormones, and people that are already strength training. It's patients that are seeking incremental improvements, not short-run or short-term miracles. We're not really looking for 25-year-old shortcuts here. These are strategic tools for adults that are looking to preserve lean mass, to reduce visceral fat, and support recovery over decades. So my final perspective really is that growth hormone peptides are not anti-aging magic. They're not replacements for testosterone optimization. They're not substitutes for disciplined sleep, and they're not substitutes for strength training. But when you use them properly, when I find the right patient with the right labs and can find some high quality sourcing, they can be a meaningful part of a comprehensive longevity plan. Remember, Sermorelin and Tesamorelin have specific FDA approval histories for very specifically defined medical conditions. Ipamorelin and CJC 1295 are commonly used off-label in performance and longevity settings. All of these require medical oversight. If you're considering these therapies, please work with a longevity physician who understands the entire system and not just one pathway. Longevity medicine really isn't about chasing one hormone. It's more about orchestration. Hey, if you found this video helpful, please consider subscribing. I'll continue to break down advanced longevity tools as the weeks go by, and I hope to do it in a way that's practical, that's balanced, and that's grounded in real clinical medicine. And remember, optimization beats excess every time.